this is Diwakar Kinra. We will complete the steps of our endodontic checklist in this short video. At this point, we have created and confirmed the final shape of our canal preparation. But this is only part of the process. Now we will examine the importance of irrigation in the cleaning and disinfection phase of treatment, as well as the obturation of this newly cleaned space. Again, we are relying on our checklist to make sure we stay on track for our treatment, allowing us to increase our success rates and decrease procedural errors. We are going to cover the last 3 points on this list: irrigation, obturation, and coronal seal. From our check film, we can make an educated guess that there will be multiple portals of exit. We also know that our files are there to shape the main canal and allow us access to all the lateral anatomy. But it's irrigation that actually cleans those spaces where our files cannot touch or reach. To properly irrigate the canal, we must allow for a soak with full-strength sodium hypochlorite. And our final rinses should follow an irrigating protocol. To take advantage of activation of our irrigating reagents, I use the Endo Activator. Our final rinse should consist of 1 minute of full-strength sodium hypochlorite with Endo Activator to remove the organic materials in the canal, such as the pulp tissue, and then air dry the canal, followed by 1 minute of 17% aqueous EDTA with the Endo Activator to remove the inorganic materials in the canal, such as the smear layer. At this point, I dry with paper points. Next, we have to obturate the space we have just vacated from irrigation. To get into all the lateral anatomy and portals of exit, a viscous form of gutta percha will be needed. The easiest way to satisfy this criteria is by heating our gutta percha. Here, we are using GuttaCore. This is a carrier-placed gutta percha in which the carrier is gutta percha also. The obturator is heated outside the tooth and then gently placed into the canal. Here is the final result from our case immediately after obturation. Finally, after obturation, a coronal seal will complete the case. Depending on when the patient is to return for final restoration, we either place endodontic sponge and cavit to eliminate the chances of contamination after completion of the root canal therapy, or a light-cured radiopaque flowable composite such as PermaFlow can be used if not restoring the tooth immediately. It's always prudent to follow up cases to make sure that the lesion and symptoms heal. As seen here in the 1-year follow-up, the patient is asymptomatic and the lesion has healed. I hope this presentation makes you want to create your own endodontic procedural checklist. I think you will find it will help you toward more consistent and more successful endodontic therapy.